Okay, so this is the provided T1 section of MRI brain axial section. First time scrolling through the entire stack, and then I will comment. I can see that there is a very prominent lobulated T1 hyperintense appearing mass, which is involving the interpedicular region extending inferiorly up to the suprasellar region and also the sellar region. This appears T1 hyperintense with internal few areas of T1 hypointensity. This appears lobulated and it is involving and it is causing the splaying of the ACAs and also the MCAs, and it has small paracavernous components. Given this location, the differentials would be of suprasellar masses, which would include pituitary adenomas, craniopharyngiomas, and I would suggest coronal sequence. I would ask for coronal sequence for further evaluation. Sagittal
You
or
talked
coronal
about
sequence.
pituitary adenomas and you
Yes,
talked about craniopharyngioma.
craniopharyngiomas. Yes, sir.
Okay. Which one do you think this is?
Sir, it is involving the sellar region, which I would confirm on the sagittal section. Uh, the bulk of the tumor is in the suprasellar region. So I'm more in the favor of craniopharyngiomas. The bulk is in the interpedicular region and suprasellar region
Just go
right
down a
here.
little bit,
Okay.
a little more.
So it is involving the sellar region and suprasellar region. Again, I am also concerned that this is involving the clivus also, I think. Okay, so this is involving right here. It is also involving the clivus.
Okay.
So I would change my differentials, and this would include uh, chordomas and chondrosarcomas of the clival region. I
Mm-hmm.
would, I will confirm my findings on the
Now we are
sagittal and
discussing
coronal
the
sequence.
differentials of clival
Yes,
lesions.
yes,
Earlier we were discussing about the differentials of sellar or suprasellar lesions.
yes, yes,
You talked about two differentials of the suprasellar lesions, which were pituitary adenoma and craniopharyngioma. And
yes,
now
sir.
you're giving me the differentials of clival lesions. You said it could be a chordoma or a chondrosarcoma. If it is a
Yes, sir.
clival lesion, could it be something else? What are the other differentials
For
of
other,
clival lesions?
in old age, this could be a plasmacytoma or a multiple myeloma in old age.
Okay, plasma. I'll take that
This
as a
could,
differential too.
okay, this could be metastasis if there's any history of known malignancy.
I'll take that as a
Uh,
differential too. Give me one more
okay,
important differential of a clival lesion.
of clival region, chondrosarcoma.
Chordoma,
Mm,
chondrosarcoma, plasmacytoma, metastasis.
no.
One more.
So I cannot think of another one. I'm sorry.
Lymphoma.
Lymphoma.
There
Yes,
you go.
yes.
You asked for the sagittal images.
Okay. So given T2 sagittal sequence, there is a lobulated mass having a prominent T2 hypointense mass involving the clival region with associated with prominent T2 hyperintense component superiorly.
Mm-hmm.
Uh, okay, it is involving the clivus and posteriorly the brainstem appears preserved. Superiorly, it is extending up to the hypothalamus. No, sorry. It is extending up to the basal frontal lobe, causing its mild compression. I would also request post-contrast sequence to look for the enhancement pattern of this.
इस
Uh,
पे कुछ और चीज है इसके अलावा मतलब इसको और थोड़ा कैरेक्टराइज करें.
uh, इसमें सर कुछ एरियाज आ रहे हैं ऑफ द सिस्टिक एरियाज आ रहे हैं inferiorly. So
ठीक है.
this could represent area of
ये
necrosis.
लेवल बन रहा है.
Yes. So there's a level on the superior aspect of this lesion, which could represent hemorrhage within this lesion,
Mm-hmm.
acute chronic hemorrhage, which is giving a fluid hematoma sign anteriorly. So this
You
represents
asked
hemorrhage.
for a post contrast, yeah? There you
Yes.
go.
Okay. So provided sagittal post-contrast sequence, which represents heterogeneous uh, enhancement within this lesion. And superiorly, this shows an area of necrosis with also fluid level seen on the above images, which represents hematoma and necrosis within this lesion. The differentials would remain the same. This appear T2 hypointense, so chordoma would appear less likely because chordoma is T2 hyperintense. And
Chondrosarcoma.
chondrosarcoma is also T2 hyperintense,
So फिर
and there are
what do
no
you think this is?
classifications. Uh, this could be a metastatic
There
lesion.
are no calcifications.
Yes, yes, there are no classifications. So chondrosarcoma will appear less likely. Is there any GRE so I can see the
I'm looking for
classification?
GRE. SWI है देखें.
So I cannot see any foci of classifications within this above mentioned level is seen.
एक मिनट अब स्क्रॉल करना छोड़े. ये वो ब्लड फ्लूइड लेवल
Okay,
आ गया.
okay, okay,
ये आप क्लाइवस के रीजन पे. डू यू सी एनी फोका
okay.
ब्लूमिंग हियर?
There are few foci, low foci right here and right here,
If you
but
think there are, tell me. If you don't think, just say so.
so I'm not convinced about the classifications.
All right, ठीक
Okay,
है.
okay.
तो अब आपके डिफरेंशियल्स क्या है?
Sir, my differentials would be of, I would ask about the patient's age. If the patient is
The
old,
patient is 55 years old.
55-year-old, the primary differentials would be a metastasis and a plasmacytoma right here.
Okay.
Because it's
I'll
completely
show
destroying
you.
the
I'll show
clivus.
you the CT scan. ठीक है.
Okay, so I can see that there are multiple eccentric foci of classification within this mass, and it is
So there
completely
were
involving the
foci of
clivus.
blooming
Uh,
on the susceptibility. ठीक है.
yes,
बहुत सारे छोटे
so
छोटे आ रहे थे.
it appears central and also slightly paracentral. So given the multiple foci of classification, the definition would be of chondrosarcoma because it is showing ring in R classification, and there is a level of hemorrhage superiorly in the superior
But it
component of
wasn't
this
following
lesion.
the chondrosarcoma signals on T2.
Some may be due to hemorrhage.
Possibly due to hemorrhage. So
Yes,
you would advise a biopsy in this patient.
yes, yes. From the transferal approach.
I'd keep two differentials in this case. One would always be a
Mhm.
metastatic disease since it's not classically
Yes,
following the chondrosarcoma signals on T2, yeah, has to
yes,
be
yes,
high.
yes,
Not sure if chondrosarcoma can present with the cystic component and bleed within the cystic component or necrotic component. Again, still chondrosarcoma would be a differential, and the other differential would be that of a metastatic disease. You need to correlate with the history of primary. If not, you'd still
yes,
advise the CT cap to look for any primary. And
yes,
chondrosarcoma still remains a differential and a biopsy of this lesion. Yeah.
yes, yes, yes.
Thank you very much. This was it for today. Inshallah, see you guys next week for
Thank you
more
so much, sir.
sessions. Thank you. Assalamu alaikum.
Thank you so much.